Pancreatic cancer causes and when to see a doctor. Pancreatic cancer is a type of cancer that begins as a growth of cells in the pancreas. The pancreas lies behind the lower part of the stomach. It makes enzymes that help digest food and hormones that help manage blood sugar. The most common type of pancreatic cancer is pancreatic ductal adenocarcinoma. This type begins in the cells that line the ducts that carry digestive enzymes out of the pancreas. Pancreatic cancer rarely is found at its early stages, when the chance of curing it is greatest. This is because it often does not cause symptoms until after it has spread to other organs. Your healthcare team considers the extent of your pancreatic cancer when creating your treatment plan. Treatment options may include surgery, chemotherapy, radiation therapy, or a mix of this. Symptoms. Pancreatic cancer often does not cause symptoms until the disease is advanced. When they happen, signs and symptoms of pancreatic cancer may include belly pain that spreads to the sides of or back, loss of appetite, weight loss, yellowing of the skin and the whites of the eyes called jaundice, light colored or floating stools, dark colored urine, itching, new diagnosis of diabetes or diabetes that's getting harder to control, pain and swelling in an arm or leg which might be caused by a blood clot, tiredness or weakness. Causes. It's not clear what causes pancreatic cancer. Doctors have found some factors that might raise the risk of this type of cancer. This include smoking and having a family history of pancreatic cancer. Understanding the pancreas. The pancreas is about 6 inches or 15 centimeters long and looks something like a pear lying on its side. It releases hormones including insulin. These hormones help the body process the sugar in the foods you eat. The pancreas also makes digestive juices to help the body digest food and take in nutrients. How pancreatic cancer forms. Pancreatic cancer happens when cells in the pancreas develop changes in their DNA. A cell's DNA holds the instructions that tell a cell what to do. In healthy cells, the instructions tell the cells to grow and multiply at a set rate. The cells die at a set time. In cancer cells, the changes give different instructions. The changes tell the cancer cells to make many more cells quickly. Cancer cells can keep living when healthy cells would die. This causes there to be too many cells. The cancer cells might form a mass called a tumor. The tumor can grow to invade and destroy healthy body tissue. In time, cancer cells can break away and spread to other parts of the body. Most pancreatic cancer begins in the cells that line the ducts of the pancreas. This type of cancer is called pancreatic ductal adenocarcinoma or pancreatic exocrine cancer. Less often, cancer can form in the hormone producing cells or the neuroendocrine cells of the pancreas. These types of cancer are called pancreatic neuroendocrine tumors or pancreatic endocrine cancer. When to see a doctor. Make an appointment with a healthcare professional if you have symptoms that worry you. Risk factors. Factors that might raise the risk of pancreatic cancer include smoking, type 2 diabetes, chronic inflammation of the pancreas called pancreatitis, family history of DNA changes that can increase cancer risk. This include changes in the BRCA2 gene, Lynch syndrome, and familial atypical multiple mole melanoma or FAMMM syndrome, family history of pancreatic cancer, obesity, older age. Most people with pancreatic cancer are over 65, drinking a lot of alcohol. Treatment. Treatment for pancreatic cancer depends on the stage of the cancer and the location. Your healthcare team also considers your overall health and your preferences. For most people, the first goal of pancreatic cancer treatment is to get rid of the cancer when possible. When that is not possible, the focus may be on improving quality of life and keeping the cancer from growing or causing more harm. Pancreatic cancer treatments may include surgery, radiation, chemotherapy, or a combination of this. When the cancer is advanced, these treatments are not likely to help. So treatment focuses on relieving symptoms to keep you as comfortable as possible for as long as possible. Complications. As pancreatic cancer progresses, it can cause complications such as weight loss. People with pancreatic cancer might lose weight as the cancer uses more of the body's energy. Nausea and vomiting caused by cancer treatments or a cancer pressing on the stomach might make it hard to eat. Sometimes the body has trouble getting nutrients from food because the pancreas is not making enough digestive juices. Jaundice. Pancreatic cancer that blocks the liver's bile duct can cause jaundice. Signs include yellowing of the skin and the whites of the eyes. Jaundice can cause dark-colored urine and pale-colored stools. Jaundice often occurs without belly pain. If the bile duct is blocked, a plastic or metal tube called a stent can be put inside it. The stent helps hold the bile duct open. This is done using a procedure called endoscopic retrograde cholangiopancreatography, also called ERCP. During ERCP, a healthcare professional puts a long tube with a tiny camera called an endoscope down the throat. The tube goes through the stomach and into the upper part of the small intestine. The health professional puts a dye into the pancreatic ducts and bile ducts through a small tube that fits through the endoscope. The dye helps the ducts show up on imaging tests. The health professional uses those images to place a stent at the right spot in the duct to help hold it open. Pain. A growing tumor may press on nerves in your abdomen, causing pain that can become severe. Pain medications can help you feel more comfortable. Treatments such as radiation and chemotherapy might help slow tumor growth and provide some pain relief. Bowel blockage. Pancreatic cancer can grow into or press on the first part of the small intestine called the duodenum. This can block the flow of digested food from the stomach into the intestines.